Now, clinical psychologist, Dr. Jeff Gardere. Thanks for your time. I mean, just two mind-boggling, horrific cases that we have here. Can you talk a little bit about the psychology behind someone, a parent, who would do this to a child or multiple children, as we're seeing in these cases?
Yeah, certainly. Thank you, Marni, for having me. And it's good to hear from Julissa and the hope that she has. When we look at cases like this isn't usually just about child neglect. It's really about a collapse of an entire family's psychological reality. We're talking about isolation, coercive control, trauma, dependency, and then accepting conditions that the rest of us would find just simply unimaginable. And certainly mental illness, I think, is something that certainly cannot be ruled out. And that may be at the foundation of what we see is going on. I know that there are psychologists who have said that this could be some sort of a cult. And so I think what we need to look at is that a family cult, if that is what is going on here, I have not examined this family, is not about religion or ideology, but more about control, psychological domination, and slow psychological deterioration in a reality that just does not make sense and that can become a house of horrors.
I heard one expert say that, while most of us know right from wrong and we see a situation like this and we can't even begin to wrap our minds around this type of abuse that is being alleged, but that they may not even see it that way, that they were doing anything wrong. Can you explain that?
Yeah, I think what we're looking at, certainly in these kinds of cases, you have to hold people responsible and culpable for the things that they've done that have hurt themselves, but certainly the entire family. That's what's most important. But I think for a person to not see the reality of what they're doing, we're seeing a combination of trauma bonding, emotional dependency, learned helplessness, fear conditioning, identity fusion, and certainly extreme mental illness. And I know that there are certain members of the family that have asked to have psychological evaluations and competency evaluations.
All right. Well, they'll be held accountable, and we'll watch how it plays through the courts. But I want to talk to you about the kids. And Julissa talked about this a little bit. I mean, there's the emotional, physical abuse and trauma that they endured while in this environment. But as she said, it's not over then. What are the challenges in trying to get these kids help? And in addition, should they stay together as a family unit, or what is the risk in that?
Yes, Jalissa is absolutely correct. The family should stay together. These children, Marni, only have themselves. That's all they know. This family, no matter how dysfunctional, pathological the parents, grandparents may be in this, whatever their mental illness is, this is all they know. So we don't want to separate the children. And so it's important, whatever treatment they get that together through family counseling. But even with the individual counseling, it's important that it be under one roof, one center, maybe just one or two therapists who can actually triangulate and get information and help one another. And most importantly, as these children go into foster care or maybe to other family members, I'm not sure, it's really important that they are not separated.
That's a challenge, though, isn't it, Doctor, with 16 kids? I mean, it's
16
one thing
children.
if it's two or three kids that you're trying to keep together, but I mean, this is a brood of a family. I mean, you've got kids from 18 months to 18 years old.
Absolutely, absolutely. It is going to be very difficult, but the needs of the few in this case outweigh the needs of the many. And it's really important that these children, no matter what the cost is to social systems, no matter what the work that has to be done, no matter what mountains are moved, these children need to stay in contact. So even if they do go into foster care, Marni, it's important that the foster care families are meeting on a weekly basis and the children are able to see one another as often as they can.
All right. Appreciate the insight. Dr. Jeff Gardere, thank you, sir.
Thank you, Marni.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.